Welcome to the Training for Healthcare Professionals. Let's begin with the module which focuses on taking care of the patient's nails and feet. Before we begin, let's take a look at the key learning objectives. After completing this module, you will be able to know the importance of patient hygiene, provide for patients' personal hygiene needs, take care of patients' nails and feet. Nails are made of keratin, which is a tough protein. Cleaned and trimmed fingernails and toenails are important for overall health. Germs often collect underneath the nails and between fingers. Frequent and thorough hand washing and foot care is a good way to prevent germ or fungus buildup. Nails that become too long or torn can scratch and cut an individual's skin and may result in a local infection. The purpose of nail and feet care of a patient is to keep nails clean, to help boost patient's self-esteem, to prevent the patient's skin from scratching, to avoid infection caused by dirty nails, to prevent odor of feet. Let's look at some of the high-risk patients for whom foot and nail care is critical. Diabetic patients should have their nail care completed by a healthcare professional. Athlete's foot patients. These patients are infected with a fungus that causes an inflammation, cracking, and peeling of the skin between the toes and can also infect the toenails and must be treated as soon as it is noted. Hemophilia patients. Injury during nail and feet care could cause major blood loss that can prove fatal for these patients. Toenails and fingernails should be kept clean, neatly trimmed, and smooth to prevent injury to skin. Trimming the nail too short may cause ingrown nails that can be painful and cause infection. Foot injuries and infections can lead to gangrene and amputation in case of diabetic patients. It is necessary to ensure nails are short, clean, and free of rough edges. Assessment of the patient's nails includes the following. Observe circulation. Observe color, sensation, and movement. You should remove nail polish to observe the color of the patient's nail. Assess for clubbing sign, that is long-term lack of oxygen, which shows as a bluish tinge in the patient's nails and feet. For assessment of feet, check feet daily for redness, warmth, or constant pain, numbness or tingling, dry, cracked skin, swelling, blisters, cuts, scratches or other sores, ingrown toenails, corns, calluses. The following items are needed for nails and feet care of the patient. 1. Personal nail cutter or nail scissors. 2. Tub or bowl. 3. Clean water. 4. Brush. 5. Soap. 6. Towels or tissue. Now let's take a look at the procedure to clean and trim nails. 1. First you should wash hands and wear gloves. 2. Then soak patient's hands and feet in warm water for 5 to 10 minutes. 3. Clean under nails and between fingers and toes using soap and brush. 4. Take one foot out and wipe with a towel. 5. Slowly cut nails one at a time, straight across and never into corners for both hands and feet. 6. Change the water and wash, rinse and dry hands and feet using a fresh towel. Do not rinse in soapy water as too much soap could chap the skin. Here are some points to remember while taking care of patients' nails and feet. You should file fingernails in one direction. Cut toenails straight across, never cut into corners. Protect against ingrown toenails by avoiding tight shoes, very high heels. Keep feet and skin of the patient clean and dry. Throw away worn-out shoes and never borrow other people's shoes. Advise diabetic patients to never walk bare feet. Individuals with diabetes need podiatrist assistance, people who are feet care experts. Encourage patients to do as much as they can for themselves. Change the patient's socks daily. Immediately report any unusual observations of the feet or nails. Now let us see a demonstration on providing nails and feet care to.
Hi, Ms. Jones. My name is Patty. I'm your CNA today. How are you?
I'm good, thank you.
Good. I need to do nail care on you. Is that okay?
That's fine.
I'm going to close your curtain for privacy, go wash my hands, and get my supplies. I'll be right back. Okay. Just going to put this on the table. This is going to help keep our clean supplies clean. And I need 2 washcloths and 2 towels. I need a basin for you to soak your hand, soap and lotion. Emery board and orange stick. I'm going to go get some water in here. I'll be right back.
Okay.
Okay, Ms. Jones, would you like to check the water temperature and make sure it's okay?
That's good.
Okay, I'm just going to set that there. If you'd like to soak one hand in there.
Okay.
Okay, gloves are optional for this skill. She doesn't have any open areas, so I don't need to use the gloves. Okay, now we're going to wash and rinse your hand and clean under your nails.
Okay.
I'm just going to get set up here. Okay, you can go ahead and lift your hand out of the bucket, and we're going to set it right here. I'm going to take a washcloth, wring it out really well, and I'm going to apply a little bit of soap to the washcloth. Pick your hand up, and we're going to wash all surfaces of the hand. Make sure we get around those rings. Get this area right here in between the thumb and the fingers. Go ahead and turn over. Clean the palm up. Okay, now you're washed. I'm going to set that to the side. We'll put your hand back over the basin, and we're going to rinse it. Go ahead and turn over. Okay. And now if you want to put your hand back over here, I'm going to dry it off. Okay. Your hand is now dry. I need to clean under your nails. I'm going to use an orange stick to do that. We're going to put the slanted end underneath the nail and take the dirt out, and I'm going to wipe it on here, okay? Just let me know if this hurts. Okay, now I need to feel for any rough edges. If I find a rough edge, I'm going to use the emery board. I'm only going to file in one direction so we don't split that nail. Okay, is that okay?
Yes.
All right, the last thing I'm going to do is put a little bit of lotion on your hands. I always want to make sure I warm that lotion up. Give your hand a little massage there. How does that feel?
Feels nice.
Okay. Now I'm going to take a corner of the towel and just wipe off any excess lotion, just in case you pick up a hot drink later. We don't want it to slip out of your hands. Okay. There you go. You're all set. I need to put these away. I'm going to go clean my basin. I'll be right back, okay?
Okay.
I'm going to put these in dirty linen. Okay, I'm going to pick up the soap and the lotion and place them in the basin. Open the drawer. Okay, these are going to be thrown away for the test. And I'm going to take the barrier from you. All of these items will be placed in the trash. Ms. Jones, your call light is right there on the bed. Is there anything else I can get for you while I'm here?
No, thank you.
You have your call light. I'm going to open your curtain and wash my hands. If there's anything else you need, just let me know.
Okay.
Okay, I'm going to review all the steps of my skill, make sure that I make any corrections necessary, and my skill is done.
Need scrubs for your new career? Visit foryouruniforms.com and enter the code CNA Video for a special discount. Need additional resources? For Your CNA has what you need. With practice tests, an online workbook, instructional videos, practice kits and supplies, and our very own skills book with step-by-step instructions, you will feel confident when you take the CNA exam. Visit foryourcna.com today. Continuing education for CNAs are called in-services. In-services are now offered online at foryourcna.com.